Looking at Mr. Nazar, A to E assessment with baseline observations of a respirate of 30, saturation of 78, heart rate of 128, and a blood pressure of 168 on 85. It is important to take into consideration that the patient's previous medical history, that history being COPD for the past 10 years, hypertension, hyperlipidemia, and having been a smoker for 30 years. Conducting an A to E assessment, he can maintain his own airway and has no obstructions. He is tachypneic and hypoxic. We should use oxygen therapy, reducing the patient's work of breathing and reduce the use of accessory muscles. It's important to take into consideration that with most COPD patients, they are CO2 retainers. So it is necessary to closely monitor patients' oxygen saturation and titration of the oxygen therapy when giving it to Mr. Nazar. Another thing to closely monitor is his blood pressure and heart rate. Given he is already presented with tachycardia and mild hypertension, he stated he self-medicated with Ventolin before admission, and this can induce tachycardia. He is distressed, and combine this with the pre-existing history of hypertension can elevate blood pressure. Then when looking at Mr. Nazar, he is distressed and has shortness of breath. Ideally, treat the shortness of breath and settle him. The case study outlines that he is confused, and this can be a side effect of hypercapnia. Low flow oxygen for shortness of breath should be administered, an emergency ABG done, and to check the concentration of CO2 in his blood. Mr. Nazar is also presented with a temperature and is febrile. This can be an indication of infection, not just an exacerbation of COPD, but also a new COVID-19 infection. Some high priority nursing interventions are oxygen therapy, regular and closely monitor patient saturation, respirate, and some patients with COPD are at high risk of retaining CO2, and excessive or uncontrolled oxygen can lead to insufficient respiratory effort or inadequate alveoli ventilation. Another nursing intervention, regular ABGs. If the patient requires long-term or consistent oxygen therapy over a set time, then regular ABGs should be considered, as COPD patients are at risk of CO2 retention. This can then lead to hypercapnia, which can then cause shortness of breath, fatigue, confusion, and disorientation. Also, a chest x-ray. Chest x-rays, having the patient have a chest x-ray, a good way to confirm if they are coming in with the signs and symptoms presented in the case study. When a patient has COPD, the chest x-ray will show that they have hyperinflated lungs. Also, a full blood count should be done. Having a full blood count done can show that if the patient has high white blood cells, neutrophils, platelets, and CRP, these can be an indication of signs of infection, as these are the cells that the body uses to fight bacteria, and the CRP is the inflammatory marker. Oxygen therapy. So some nursing considerations when administering these therapies. So oxygen therapy, when administering oxygen therapy to a patient with COPD, things to take into consideration are starting with low flow oxygen, 1 to 2 liters on nasal prongs, to reduce the chance of suppressing the patient's hypoxic drive. Another is having a target oxygen saturation, 88 to 92%, as high oxygen levels can lead to carbon dioxide retention. The patient should be continuously monitored, regular respirate and regular respirate checked, regular listening to the patient's lung sounds as well. When administering Ventolin, Monitor for patient side effects like tachycardia, tremors, or palpitations. This should be done by checking the patient's observations, heart rate, and blood pressure before giving Ventolin, before and after giving Ventolin. Monitor if the inhaler is having a therapeutic effect by checking if the patient's breathlessness, respirate, and lung sounds are improving. When administering azithromycin monitor for side effects, so nausea, diarrhea, abdomen pain, and in some situations it can also lead to cardiac issues or prolonged QT intervals. If this happens, ECGs must be done, medical officer must be informed, and monitoring should be continued. When administering Paxlovid, which is the COVID-19 antiviral, watch out for patient side effects such as altered taste, diarrhea, and hypertension. These can be monitored with regular observations, checks. When administering medication, check if the drug interactions with other treatments being given. Consult the pharmacist if needed. The patient's liver, as well as with this particular drug, patient's liver function should be monitored as this drug affects the CY3A enzyme in the liver. And lastly, when administering Atrovent, monitor the patient for side effects, so dry mouth, headache, dizziness, and blurred vision. Monitor if the inhaler/nebulizer is having a therapeutic effect. This can be done by monitoring lung sounds, monitoring the patient's work of breathing, and use of accessory muscles when breathing, and monitoring the patient's oxygen saturation or regular observation checks. Ideally, these should all improve. Thank you.